Part 2 of domestic violence, we're going to start out talking about elder abuse. Elders are vulnerable because they're often in poor mental or physical health or are disruptive like Alzheimer's disease. The dependency needs of older adults are usually what put them at risk for abuse. The typical victim is female, over 75 years of age, Caucasian, living with a relative and usually experiencing a physical or mental impairment. And often caregivers have a difficult time dealing with the added responsibilities that can lead to the elder abuse. So common types of elder abuse: physical is inflicting harm, striking, hitting, beating, pushing, shoving, shaking, slapping, or kicking are considered physical abuse. Inappropriate use of physical restraints, which include tie-downs or straps, and inappropriate use of medications like sedating or tranquilizing drugs. Psychological is inflicting emotional pain or distress onto the elder. Verbal abuse includes intimidation through yelling or threats, humiliation and ridicule, habitual blaming or scapegoating. And nonverbal abuse includes ignoring the elderly person, isolating them from friends or activities, and terrorizing or menacing them. Another type is financial. It's the unauthorized use of an elderly person's funds or property, either by a caregiver or an outside scam artist. Examples include misuse of an elder's personal checks, credit cards or accounts, stealing cash, income checks, or household goods, forging their signature, engaging in identity theft. Typical rackets that target elders include announcements of a prize that the elderly person has won but must pay money to claim, phony charities, or investment fraud. And then finally, neglect is failure to fulfill a caretaker's obligation, constitutes more than half of all reported cases of elder abuse. Examples of that include pressure or bed sores, unclean or smells of feces or urine. So what to do if you expect? Interview the patient, look for discrepancies in their stories, document the encounter, keep questions simple and clear, assess for physical status, and document any unusual findings. And remember, don't accept labels that others tell you. You need to assess for yourself. Also you need to assess the environment, determine competency of the patient, consult as needed. If competent, discuss findings and offer to report. Give resources for patient to keep in case they need them. If they're not competent, report to the authorities. All right, now let's talk about child abuse. According to the Wisconsin Chapter 948 legislative document, a child is a person who has not attained the age of 18. Physical abuse is the infliction of physical pain or bodily harm. Signs and symptoms include bruises in areas where normal childhood activity would not usually result in bruising, burns in identifiable shapes like cigarettes, lighters in cars, stoves, and bathtubs, and missing patches of hair. Exams and tests include bleeding in the back of the eye or collection of blood in the brain that may represent shaken baby syndrome or a direct blow to the head. Fractures at the tip of the long bones or spiral type fractures that result from twisting. Evidence of a skull fracture. Fractured ribs, especially in the back. And internal bleeding. Consider the possibility of physical abuse if the parent or caregiver offers conflicting, unconvincing, or no explanation for the child's injury. If they describe the child as evil or in some other very negative way. If they use harsh physical discipline with the child or has a history of abuse as a child. So, accidental or abuse. Note the high incidence areas of abuse that include buttocks, feet, and bilateral hands. So who is abusing? Number 1 is the mother. Number 2 is the boyfriend. And 3 is either a father or a babysitter. Emotional abuse is harm to the child's psychological or intellectual functioning, causing severe anxiety, depression, or aggression. You'll see withdrawal from friends and activities, and they feel self-worthlessness. Consider the possibility of emotional maltreatment when the parent or other adult caregiver constantly blames, belittles, or berates the child, is concerned about the child and refuses to consider offers of help for the child's problems, or overtly rejects the child. Think about those parents who had their child in a dog cage for years in Milwaukee. Neglect is a form of abuse that involves failure to provide for or attend to basic physical, emotional, educational, or medical needs of another. Emotional is loss of self-esteem, fearful of changes, mistrusting, and withdrawn. Lacks needed medical or dental care, immunizations, or glasses. Consider the child neglect when the parent or caregiver appears to be indifferent to the child, seems apathetic or depressed, behaves irrationally or in a bizarre manner, or is abusing alcohol or other drugs. And then sexual abuse is any form of sexual contact or exposure without consent or incapable of giving consent. For children, this is anyone under the age of 18. How to assess if it's a young child? With physical assessment and sometimes use of dolls. What would lead you to suspect, or how could you assess? What techniques can you perform to probe the questionable injuries or incident? Talk with the child alone and obtain history of incident. Interview parents separate and look for discrepancies in their stories. An example is the injury does not look like an injury from a fall, but rather a blow to the whatever. Do a thorough assessment of the child. Ask open-ended questions. You can use play therapy to assess how the child views relationships. Have them draw a picture. Have them undress fully to look at their entire body, but use a gown to keep them private. And be aware that the injuries may be explainable. Keep an open mind. A person responsible for the child's welfare is guilty of a Class F felony if that person has knowledge that another person intends to cause, is causing, or has intentionally or recklessly caused great bodily harm to a child. A person responsible for the child's welfare is guilty of a Class H felony if that person has knowledge that another person intends to cause, is causing, or has intentionally or recklessly caused bodily harm to a child. So just remember that. So reporting. When? Immediately once the situation raises questions. How? You need to consult with a physician on duty, hospital supervisor, social services at the organization. Review their policy. Contact local county social service department, sheriff, or city police department immediately by telephone or in person. And then what do you report? Explain what happened and the nature of the abuse. Be as specific as possible. Tell all you know of the situation. Be sure that your charting is accurate and take pictures if appropriate. And then what will occur? A social worker will assess the situation and will determine how to protect the child if needed. The county will inform the mandatory reporter what actions, if any, were taken to protect the child. If the child is not admitted, they're taken to a safe and secure location. If the child is admitted, there's limited supervised or no visitation by the family. And then what about child-on-child violence? A child's aggression is more impulsive and unrestrained than adult violence, like siblings. Makes it more anxious, provoking. More at risk for developing symptoms because of repeated attacks, create a pervasively insecure environment. Bullying is intentional tormenting in physical, verbal, or psychological ways. It can range from hitting, shoving, name-calling, threats, and mocking to extorting money and treasured possessions. Some kids bully by shunning others and spreading rumors about them. Others use email, chat rooms, instant messages, social networking websites, and text messages to taunt others or hurt their feelings. It's important to take bullying seriously and not just brush it off as something that kids have to tough out. The effects can be serious and affect kids' sense of self-worth in future relationships. In severe cases, bullying has contributed to tragedies such as school shootings and suicides. And then now let's talk about rape and sexual assault. Rape is non-consensual vaginal, anal, or oral penetration obtained by force or by threat of bodily harm, or when a person is incapable of giving consent. Attempted rape includes physical attempts and verbal threats of rape. And the nurse's role is providing holistic care for the sexually assaulted and help to preserve evidence that could lead to prosecution of the perpetrator. Was there consent? Date rape drugs render a woman's capacity of resisting an attack. Victims lose their ability to ward off attackers, develop amnesia, and become unreliable witnesses. Drug-Induced Rape Prevention and Punishment Act in 1996 says there's up to 20 years imprisonment and fines. Types of drugs that are used include GHB, Rohypnol or roofies, and ketamine. And marriage is not a free-for-all. Women still have a choice. There's a rape trauma syndrome. The acute phase is immediately after the assault and may last for 2 to 3 weeks. Initial reactions may vary but can include shock, numbness, and disbelief, hysterical, restless crying, and anger. Long-term reorganization phase occurs 2 or more weeks after the rape, and victims often experience intrusive thoughts like flashbacks and reliving the traumatic experience. Increased activity like taking trips, changing phone numbers, spending time with friends, and increased emotional lability like anxiety, mood swings, crying spells, and depression. Some nursing interventions tell them, you are safe now. Be sensitive to their needs. Physical injuries may not be apparent. There might be STD risk or possible pregnancy. There's a rape kit that's used for evidence. Instruct that if they wish to report, they should not wash, shower, brush teeth, use mouthwash, drink, as to preserve physical evidence. Ask about clothes worn during the attack and preserve as evidence. Obtain a release and permission for photographing or taking of evidence. Follow the hospital sexual assault protocol, preserving and collecting the specimens. And the physician should do a pelvic exam, and it's often very hard for the patient. Should also use a SANE nurse when available. And give referral. Have local sexual assault advocate on hand to support and offer resources. Also educate on primary prevention. They should vary their routine. Be careful when using alcohol. Arrange for their own transportation. Avoid secluded places. Walk in groups. Know the people you're alone with. Caution date rape. Clear expectations. Be aware of date rape drugs. Lacks odor, taste, and color. Causes impairment of judgment and memory drowsiness. Confusion lasts 15 to 20 minutes. Will appear intoxicated. Order your own drinks and stay with them, and don't leave them unattended. And it's a nurse's responsibility to provide patients with resources. Be sure to know what's available in your area and where you can refer people to. And here are a few things that you can use in your resources library. So keep track of this. And that brings us to the end of this lecture.